So how common is male breast cancer? Well, male breast cancer is rare. Less than 1% of all breast cancers is in men. In the UK, there are fewer than 400 cases a year. Most breast oncologists won't really have had much experience or any experience of treating male breast cancers. So in terms of common risk factors for male breast cancer, like all cancers, male breast cancer is more common with advancing age, with the peak incidence between 60 and 70. It's also linked to obesity or an underlying genetic mutation. So about 1 in 8 male breast cancers will have an underlying gene mutation, such as the BRCA1 or 2 genes. So in terms of the prognosis for male breast cancer, prognosis is similar to that in women, stage for stage. But the problem is it's often that the male breast cancers present later because they may have not been diagnosed, or the diagnosis may not have been considered, or patients may have presented later. And there was also historically an element of undertreatment, which meant that also outcomes for male breast cancers would appear less favorable than women. To make a diagnosis of male breast cancer, it's much the same as we would consider for a woman with breast cancer. So taking a careful history, examining, and then doing a biopsy and imaging. So in terms of imaging, this might be an ultrasound, MRI, or a mammogram. So mammograms are still possible in men. So overall, the process is still much the same. So in terms of treatment for male breast cancers, it's very similar with a few subtle differences and exceptions. So the mainstay of breast cancer, both for men and women, is surgery. Usually for men, there would be a mastectomy, so removal of all of the breast tissue, rather than breast conserving surgery, which is still done in some patients, but less so, less commonly so. Patients may be offered chemotherapy and radiotherapy, depending on what the type of tumor and the extent of the disease, in the same way as women. In terms of endocrine treatment, of course, hormones are different in men and women. And so in order to use the same treatments in men, we need to make some subtle adjustments. And that usually means an injection to switch off the male hormones to allow us to then use the same hormone treatments that were designed for women. And this is part of the problem, that when we consider evidence-based medicine in treatment of breast cancers, we're looking at clinical trials that usually didn't recruit any men, rightly so, because, understandably so, because male breast cancer is very rare. And so we are looking at results and for treatments that were designed in women, but we know that on the whole, they can be extrapolated to men and used in men. So it's just having more information and understanding as time goes on, that we can treat male breast cancers in a similar way, with similar outcomes.